And we're here now with Rick Page, the CEO of Meridian Health Services. And Rick, first of all, explain from your perspective, Meridian.
Well, thanks first for having me here. Meridian Health Services, we provide addiction treatment. We try to be the best provider in the field of addiction treatment that we can be. We've been doing it since 1968, and since that time frame, or during that time frame, how we provide services has changed very, very dramatically and significantly.
And it's more about the client or the patient, right? Rather than what society says.
It's all about the client and patient. It's all about person-centered care and treating addiction as a chronic illness as opposed to an acute condition.
And why do you think so many people dismiss addiction? That person is not. They're irredeemable. They can't be helped. You can give testimony to the fact that they actually can. Can you talk about that?
Yeah, I think a lot of it has to do with the stigma, and what a lot of people don't understand, and myself included, when I was younger, addiction, you can almost think of when you see a person who is suffering from addiction as two people. You have the disease that will do anything that it can possibly do to satisfy its fix. And then you have the person that you knew as a child, or the person that you married, or your mom or your dad or your coworker. They're two separate people, but you can't distinguish that from the outside looking in. And so what an outsider sees is behavior that they disagree with, behavior that is contrary to social norms, behavior that is perhaps criminal, because the disease is controlling them and telling them that they need to do whatever they can do to fix that need, which is primary to the person.
So what does Meridian do? You said that the care has changed dramatically over the last, significantly really in the last 5 to 10 years. Could you explain? You guys are really, you're at the forefront of the new way of sort of focusing on this, right?
Yeah, I think so. I think we try to be. And what we try to do is we are constantly looking at what others in the industry are doing, what others in the field are doing. We work with consultants to make sure that we are providing the best evidence-based care. But most importantly, what we do is person-centered care. And person-centered care, there are a really unknown number of roads to recovery. They're as varied as they are people, right? And so for one person who might really, really like the mutual aid societies, like the 12-step program of Alcoholics Anonymous, that might be great, and that might be that person's saving program. But then there might be another person who it doesn't work for them, and they need cognitive behavioral therapy or dialectical behavioral therapy. And so we're constantly looking at what is available out there in terms of the tools that we can use to help our folks, and then applying those tools based on the assessment that we do of each individual that comes through our doors.
So where are you hoping that Meridian goes in the next 5 years?
So we are part of what is called a recovery-oriented system of care. And it's different than what I alluded to earlier, which is a lot of people, for sure 10 years ago, 15 years ago, addiction was treated as an acute problem, like a cold. And so the doctor would prescribe treatment for 2 weeks, and then you're supposed to be all better. What we've recognized now is the disease is more akin to diabetes, a chronic condition that you're going to live with for the rest of your life. And as part of that, as a member of that recovery-oriented system of care, we provide one piece of that service, but we have to closely coordinate and integrate with other pieces. So someone who has an addiction problem likely also has a lot of social problems. So we work with supports in the community to help those people with their social problems. They also likely have a lot of physical problems that haven't been taken care of, so we work closely with physicians and doctors to take care of that. Right now it's more of a loosely coordinated a system of care, and over the next 5 years we want to tighten that up, integrate it closer. So my dream would be in 5 to 10 years we would have a full system of care under one roof, so that we can take care of all aspects of a client's needs, not just the addiction problem, but the mental health problem that goes along with it, and many times the physical health problems that go along with it.
Are you seeing an increase in the need for your services?
Oh, most definitely. I think there's the pandemic is part of it. I think a lot of people have started using substances during the pandemic that weren't using them before. I think the legalization of marijuana throughout the country is a big part of it. It is a gateway drug for many people, not for all people, but for many people. And there's just more of an acceptance of substance use in society in general than there was, say, 10, 15 years ago. As a result, there's more of a need for the services that we provide.
They actually are talking about legalizing other more illicit drugs. Can you speak to that? Or?
Yeah, I think so. You have to be careful when they say legalizing. They're not necessarily talking about legalizing other drugs right now, although we could get there. What they're talking about is decriminalizing them.
Yeah.
So that if you get caught with an opioid, using an opioid, possessing an opioid, or something like that, instead of going straight to prison or to jail, you are required to go through a treatment program like this program. I'm not necessarily against that, as long as it is a gradual progression, so that if first a person is caught using opioids or possessing opioids, they are required to go to treatment. If they don't follow through on that treatment, then there should be a criminal element attached to that, because in many instances you really need to have folks that have real consequences in order for them to focus on treatment. That's not always the case, but in many cases you have to be motivated to want to get better. And in a lot of folks, that motivation is external. And if it means criminal penalties, then great, let's have criminal penalties. One of the most successful treatment programs is for folks in the medical field. And the reason it's very successful is you can lose your medical license if you don't follow through on the treatment plans and don't follow through with treatment. And that is a real significant consequence for those people. So when you look at successful programs, those are very successful.
So going forward, what do you plan to do in terms of increasing? Do you want a larger space? Are you trying to get more beds to get more treatment for more people? Because, as you said, there's seems to be a greater need.
Yeah, I think our goal would be to expand the scope of services that we provide. Not necessarily expand the number of beds that we have, but expand the scope of services so that we are a true behavioral health organization. Right now, we focus on addiction treatment, and we also treat co-occurring disorders. What I want to be able to do is treat anybody that has behavioral health issues that might someday lead to substance abuse, to be able to come to us, whether they have a current substance use problem or not.
And a lot of people, if they're not if they don't have addictions themselves, they know people who have it. This is a personal thing. You're not just the CEO. You are familiar with addiction. So how does it feel to know that you are helping to change lives?
Well, I think first of all, it's great to be part of a community-based organization because it's very rewarding to see people come through the organization and actually have success. But I can't take the credit for that because I'm not the one on the front lines. It's my staff. And one of the things that's unique about Meridian is that the staff is compassionate, very compassionate about what they do. And I think part of the reason is if we hire somebody that's not compassionate about providing the services that we provide, they don't last very long. And it's because the people that are here care and they want to do it. So I feel good about being able to help those folks provide the services, our therapists, our case managers, our milieu technicians, our nurses, our doctors. They're the ones on the front line. I'm just supporting them.
Rick Page, CEO of Meridian Health Services, thanks.
Thank you very much for having us, and thank you for doing this. If you or someone you know needs help with addiction treatment, please contact Meridian Health Services at 248-599-8999.